Hello, this is Dr. Bill McNett from Nemours, and we're going to have a panel discussion specifically for our parents about how to get our kids back to school or to remote learning. And what this came out of, that we have had so many questions as pediatricians from parents about what's the safest way to do this, or how can I do this? And one of the things that we found out is that we have so many different kinds of families, and every family is different with different circumstances. So what we wanted to do tonight is to have an opportunity to listen to our experts. And so we're going to be hearing from Dr. Salwa Suleiman, who's an ID specialist. An ID specialist is somebody who has done additional training in infectious disease. And her division have been incredibly busy during this pandemic. She and her colleagues are our go-to people for us as pediatricians, as our experts. So we wanted to let you have an opportunity to hear it directly from the experts. In addition to that, we have two of our great pediatricians, Dr. Harry Lehman from Delaware and Dr. Yamira Coutinho from Pennsylvania, who are practicing pediatricians within our system also. One of the things that we like to do at Nemours, we have a tradition of something called Connect the Purpose. And what it does is just anytime we have meetings or gatherings, we like to just talk about something clinical and something that just happened to me recently, and this is to connect the purpose as to why we're here and why we're talking about this. It is recently found out that the father of 4 of my patients recently passed away from COVID virus. He was in his mid-50s. He had 4 wonderful kids who are now young adults, and one is entering into college. And it's very meaningful when I think all of us have had stories where COVID has touched us personally and not just professionally. So the George Piccoli family, I send my condolences. It is so difficult to hear about George's passing, and his lovely family, I'm sure, is missing him terribly. So with that, we're going to continue. We're going to start, before we get started, I'm sorry. One of the things that we do want to hear is from you. We're going to have an opportunity to answer your questions. We have a chat feature. Familiarize yourself with the chat feature. We're going to remind you that everybody's going to see your questions. So we ask you not to give personal, private information out during your questions. And we're going to get to as many questions as we possibly can during this. And we'll have our panel help us with that. So with that, Dr. Suleiman, can you give us the latest update on what's going on with COVID-19 and the pediatric population?
Absolutely. Thank you, Bill. Hello, everyone. My name is Salwa Suleiman. I'm one of the pediatric infectious disease doctors at Nemours, and I am happy to be speaking to you to talk a little bit about COVID-19, some of the background on COVID-19 and what we know now, which is certainly a lot more than we knew 6 months ago. And so the name of the game here has been really flexibility and pivoting and changing and learning. And so I'll try to update you on the most up-to-date information that we know so far. Next slide. So this is a picture of the virus. I started a lot of my talks about coronavirus talking about the virus. So on the left-hand side, this is a scanning micrograph of coronavirus. It has these nice, really pretty spikes to it, which causes a lot of the reason why coronavirus can cause such problems. You'll see the right-hand side is a picture that I think a lot of children can relate to, my boys can relate to as well. And it shows them that this is what the virus looks like, and these spikes really are what can cause trouble. Coronaviruses have been around since around the 1960s. We have about 4 coronaviruses that circulate in the United States on a rotating basis. But this is a very different virus. This virus we have never seen before. And this virus is certainly something that is new to all of us. It is very similar to SARS-CoV-1, which stands for Severe Acute Respiratory Syndrome Virus #1. There wasn't a #1 before, but now it's 1 because now we have 2, SARS-CoV-2, and that virus is the name of the virus that causes COVID-19 infection. Next slide, please. So this is a picture of the current hotspots in the United States. This is actually taken from a CDC heat map, essentially looking at current spots. The red is the most hot, where the most cases are currently. So if you looked at this picture across the United States, there is coronavirus all over the U.S. But this is where the hottest areas are right now. You can see the southeastern United States is really very red. The Northeast still has some cases, but looks relatively good. And the middle to sort of western part of the country, where there in generally are less people and less dense populations, are a bit spared at the moment, except for California and some in Washington state. Next slide, please. This is a number of new cases by day. So this number is really reflective of testing. I think what I would urge everyone to note is that new cases is always going to be reflective of testing and is not necessarily reflective of the worsening of the disease and the spread. And this is across the entire U.S. So if you look from March to August, you can see that we had the highest number of new cases identified by testing middle of July, and then we've sort of had a dip. But arguably, we had the highest number of cases in our area and the cases of symptomatic disease April and May. Next slide. So this is a picture of COVID-19 in our area. And you can see that the darker orange is the higher concentration of cases, and this is per 100,000 people. So it certainly looks at the population. But generally, the takeaway from this is we're in a much better place than the southeastern U.S. for sure. And we have had some of our lowest number of cases in the last 6 months in the last month. Which is really, really good. So you can see that the Philadelphia area is sort of in this average, we're sort of rolling with cases, but we're not having a huge uptick. Southern Delaware has an increase because there's not a lot of people, but there have been a couple little clustered outbreaks, and so that increases that number. Next slide, please. Now let's look at pediatric cases. So we are learning a lot more about pediatric cases, and overall, we have much fewer pediatric cases than we do adult cases, which has been a really interesting thing because a lot of kids typically get the virus first or are more susceptible than the adults, but that particularly with respiratory viruses, very different for SARS-CoV-2 infection or COVID-19. So this picture comes from the American Academy of Pediatrics. And this was updated 1 week ago exactly. There wasn't any new information. I was hoping it would be there today and I could help you out. But this data here, and you can see the PA, New Jersey, and Delaware numbers coming up here to sort of help you out and look at that, basically shows us that over the last 6 months, this is where we fall in the number of states in total cases. This is not new cases, this is total cases. So Delaware, as you can imagine, a smaller state has fewer cases. You can see New Jersey in the middle and PA a little bit sort of in the upper quarter. And we've had about 406,000 total child COVID-19 cases out of the 5.5 million that we've seen so far in the U.S. And this is the most up-to-date data we have, which we have not gotten recently. Next slide, please. This is in our area. So these are pediatric cases. So the American Academy of Pediatrics took the child population in 2019. You can see those numbers first on the left-hand side, and then the cumulative number of COVID-19 cases and the percent total. So about 7% in Pennsylvania and Delaware and only 3% in New Jersey. Hospitalization rates, even more importantly, are very, very low for pediatrics. As much as we were prepared for it, we have seen very few hospitalizations. And this slide here is going to help you sort of get a perspective on the adult hospitalizations versus the pediatric hospitalizations. So the very top bar is the red, that's 65 and up as far as age group. And the very bottom bar, which you can probably barely see, is sort of this like orange color and is 0 to 4, and it's very, very low. And then there's also a one that sort of goes right on top of it, which is a navy blue bar, again, very, very low, which is 5 to 17. So 18 and under, the hospitalization rates are in the 1 to 2% range. Very low, which has been very good for us. Next slide, please. All right, so I'm going to spend a little bit of time on these two next slides. So one is COVID-19 transmission and talks about the difference between respiratory droplets and aerosols. Okay, so transmission, two major ways, respiratory and contact. We'll talk about contact in a second. But respiratory spread is how a lot of viruses are transmitted. Influenza virus, other sort of rhinovirus, the common cold, and they're spread by droplets, large droplets, or small droplets. Coronavirus is a huge, huge, huge droplet. It goes out and down, as you can see in the picture on the left. So COVID-19 or SARS-CoV-2 infection, typically when you talk, you cough, you sneeze, you spit, it's going to go out and down, typically within 3 feet actually, but if you have a forceful cough, it can go out to 6 feet, hence the reason for 6 feet of social distancing. And so what I encourage people to understand is that the droplet it does not stay suspended in air for very long. It's very heavy and it goes out and down. Very different from, for example, the chickenpox virus. So the chickenpox virus or varicella zoster virus, tiny, tiny, tiny. And it gets aerosolized into the environment and it stays in the air suspended for long periods of time. And so that, as you can see in this picture, it stays up in the air, and that's what we call airborne disease. So it stays suspended. COVID-19 does not do that unless you make it into a tiny, tiny, tiny little droplet by doing something called aerosolizing it. So go to the next slide. You're going to see here that in 1 to 3 feet, large droplets go out. 3 to 6 feet, maybe if you have a forceful cough, it's going to fall in that range. But to get further than that, you really need to aerosolize it. So potentially having a breathing treatment, not through a spacer or an inhaler, but a nebulizer, getting a tube put down your throat, different types of things that really happen mostly in the hospital are going to be things that can aerosolize it in the environment. So this is where the masks come into huge play and social distancing comes into huge play, is that if you stay 6 feet away and you wear that mask to keep your snot and your spit in, spread really diminishes. Next slide. Okay, one other thing, and I'm realizing I forgot to talk about transmission, is I wanted to mention one thing about transmission that you probably heard recently. If you could go back to the slide previously, is the age at which you can transmit virus. Because there's been a lot of discussion around a new article that came out looking at kids and what sort of, if younger ages can transmit virus less than or better than older ages. So what we don't know is how much, so we can identify how much virus is in my nose, but how much virus comes out of my mouth and goes out and then can transmit to you. We don't know what we call replication competent virus. What we don't know is how young you have to be to spread the virus out and then for it to come to me and then cause me to have disease. This is what we're trying to understand. But that study basically said kids less than 5 have a lot of virus in their nose and actually more virus than people that were 5 to 17 and 18 to 65. But what it didn't tell us is if those patients, if that can actually transmit more infection, which is what we have to learn. And I think a lot of people are trying to study that right now. So I just wanted to clarify that really quickly because it tells us they have virus, but it does not tell us whether they've transmitted it or not. Next slide, please. So these are the signs and symptoms associated with COVID-19. The major ones are fever, cough, and shortness of breath. There's been lots of other symptoms that have come along the way. I would tell you in pediatrics, we are seeing some diarrhea, some muscle aches, some sore throat, a little bit of headache. Loss of smell and taste is not on this list, and it could certainly be added, but we don't really know the difference between pediatric and adults. But that is certainly something people are describing, and I think likely adults are describing that more because they can potentially verbalize it better than kids, but it is on that list. But if you look at the difference between kids and adults, only about 50% of kids have fever and cough, and I will tell you from just experience in seeing these patients, not all of them have fever, and so that in and of itself can be a bit tricky for us to try to figure out, but ultimately the majority of them have fever and cough and shortness of breath, and all three together is about 75% of patients that we see. Adults, on the other hand, the overwhelming majority have fever and cough. Some have shortness of breath, and then some have some of the other symptoms that you see there on that slide. So the main symptoms, fever, cough, shortness of breath, but there are a couple other things to be thinking about. for the signs and symptoms of COVID-19. Next slide, please. So I would be remiss if we talked about COVID-19 and did not talk about MIS-C, or multi-system inflammatory syndrome in children. So this has been a very interesting phenomenon that we all identified in April-ish, and said to ourselves, there's some unusual cases that are happening, and we've seen some in our area, and there's definitely been some nationwide. And these are children who have this inflammatory process that happens, looks very similar to something called Kawasaki disease, if you've ever heard of that before, and is typically actually after COVID infection. So it's not when you have infection at the time, it's after. And this is somebody with persistent fever. They don't generally have cough. They don't generally have shortness of breath, but they have fever, and they can get this very interesting rash that can be a red rash all over the body. Generally, it's not itchy, but it's a red rash. It can come and go. They get conjunctivitis, or like pink eye. They can get abdominal pain and diarrhea, which is a very interesting and very consistent feature. They can have nausea and vomiting associated with that. And then they can also have headache and sometimes confusion. And when they come into the hospital, they have a lot of abnormalities in their lab work, white blood cell counts, red blood cell counts, platelet counts. And then we also can look for different things when we do imaging, and we look at their chest x-rays, we look at their abdomen, those types of things. And then some of them are even very, very sick, and so multiple organs are not working. And so if your child has a persistent fever and any of these other symptoms, and we can't really explain it, this is something that people are looking for. Doctors, physicians, providers, nurse practitioners are all looking for to make sure that this is not what your child might have. Next slide, please. Testing. So there are three main types of testing, and I wanted to just briefly go through them. So PCR-based testing is called polymerase chain reaction. It basically looks for the genetic blueprint of the virus, the DNA, the RNA of the virus. This has been the majority of the tests that have been done. Nasal swabs and oral swabs have been, again, the majority, and it looks for presence of virus right in this moment, if you've got virus that's replicating in your body. The saliva-based test that just came out, was just approved days ago, also falls into this category of PCR-based tests. So this is really this is the hallmark and really the gold standard for testing right now to know if you have virus in this moment. Antigen testing looks for presence of the virus right now, but it's a blood test. I would caution the use of antigen testing at this point. There have been a few that have been approved, but the majority of them have not really been reliable. And so really PCR-based testing is gold standard. And then antibody testing, also a very hot topic. This looks for the presence of memory to the virus. So have I ever seen the virus before? Has my immune system ever seen the virus before? And do I have memory? And so this is a blood test that looks for presence of virus in the past. And I would tell you that this is also evolving, that it can show presence of virus in the past, but it does not tell you if you are immune to it moving forward, which is a huge limitation of the test. And so the only time antibody testing would really be helpful is actually in those cases of MIS-C, where we're looking to see if they had COVID infection in the past. Next slide, please. So who should get tested? So patients who have signs or symptoms consistent with COVID-19. If you fall into those symptoms that we listed, any patient with those symptoms should get tested. Also, symptomatic individuals with recent known or suspected exposure to someone with COVID-19. So if the mom in the household recently had COVID-19 and now the kiddo also has symptoms consistent with that, I would certainly recommend testing in that particular situation. And then all close contacts of patients or of persons who have been confirmed or have probable COVID-19. So if, again, mom in the household has symptoms consistent with COVID-19, is waiting to get tested, or has recently tested positive, all close contacts should be tested. And this includes any individual that comes within 6 feet of someone and for at least 15 minutes. So that's what's considered exposure. Next slide, please. So stopping the spread. Can we talk about washing our hands? I talk to my boys about it all the time. They never want to do it. It's the age-old battle for all parents. Clean your hands, wash your hands. So 20 seconds soap and water. Sing the happy birthday song 2 times through. And that's what I try to do with my kids as much as I can. 20 seconds is a long time. So try to have them wash their hands as much as possible. If you don't have soap and water, use a hand sanitizer that has at least 60% alcohol. So anything with 60% alcohol is going to be good and sufficient to also kill the virus. What you want to do is rub, rub, rub until it's dry. Don't wave your hands in the air waiting for it to dry. That friction is really, really important. And then trying to get your kids to not touch their face. It's hard. I understand. It's just trying to encourage them not to do that. Wearing a mask, very important. And remember, when you wear a mask, wearing the mask is most important to protect everyone around you. So we have never been in a situation in the United States or in the world where we have worn a mask not to protect ourselves, but to protect everyone else. So does a mask protect me? It does. It protects me a little bit. It gives a barrier against my nose and my mouth, but it mostly protects everyone around you. And so make sure that mask covers the nose and covers the mouth, where all that keeps that snot and that spit in and not out in the world. Next slide, please. Physical distancing. Social distancing is, a huge term in 2020. It's very important, keeping 6 feet between yourself and others, even with a mask on. It's not or, it's and. So social distancing and a mask. Avoiding close contact with folks if you're sick. If you are sick, please just stay home. Even if you think it might just be your allergies, please stay home because you just never know. Next one is clean and disinfect. I'm not sure how well you can see that, but it comes up a little bit light. But clean and disinfect, high-touch surfaces. So even if you just have vinegar at home, if you have some type of bleach-based cleaner, that's the best. But if you can clean and disinfect door handles, toilet handles, sink knobs, the refrigerator doors, all high-touch surfaces in your house, if you can just take a clean swipe through them every day, it's going to be really important. Next slide, please. Okay, so prevention in schools, masking for all. I have thought about this and talked about this. I obviously have kids in school, and I know you're all wondering, since this is the particular topic of this, but it's really important to look at your school district and look at your school and what are they providing to your patients, to your children. What are they doing to prevent the spread of COVID-19? So it's really important to make sure that you're able to identify that they can do these things, and they're going through all the measures. So masking for everyone, faculty, staff, and students. Hand washing stations available, hand sanitizer available to anyone who enters the building. A lot of schools are restricting outside visitors. That is very important. And if anyone comes in, they have to wash their hands. Minimizing contact on shared surfaces, leaving doors open when kids have to go into school, and limiting things that are shared is important. And also increasing regular surface cleaning. A lot of schools are increasing their environmental services departments and getting more cleaning of the schools throughout the day. Limit large gatherings, so assemblies, lunchtime, meetings, school entrances, not allowing kids to sort of congregate in certain spaces, and also to have backups, particularly when they're going into school, is going to be very important. A lot of kids they're trying to have sort of scheduled drop-offs. A lot of schools are trying to sort of stagger things so there's not big backups. Reorganizing classrooms to enable physical distancing. So splitting some classes in half, using rooms that weren't previously classrooms into spaces so everyone can be 6 feet apart, desks can be 6 feet apart. If they're at tables, they can be separated in a certain way, but it's very important to use larger spaces. And then cohorting faculty, staff, and students into pods, bubbles, cohorts, and this is where this hybrid model can come into play too. But this really allows for contact tracing if there's an exposure. So if one school teacher or one classmate is positive for COVID-19, you only have to quarantine that cohort of people instead of trying to trace down who they've come in contact with throughout the day. So where do we go from here? And this is sort of on my last couple slides. I think there are 3 scenarios that can happen. So scenario 1 is continued small waves. We had a big peak in the spring. We're going to have these little small waves every 3, 4, 5 months. The next scenario is going to be that there is going to be an even bigger peak in the fall and the winter, which all of us take a collective pause because we think to ourselves, oh my goodness, we don't want this to happen. Very similar to the 1918 flu pandemic. And then there can be also little waves. I think that's less likely to happen, knock on wood, but it could. And then continued outbreaks in city after city. And so this would be that we have a similar outbreak to what we had in the spring every 3 to 4 months in different parts of the country. Arguably, that could be what's happening right now. But it is not, I think right now is more reflective of not doing the mitigation strategies that need to happen and not necessarily the virus getting out of control. So again, all of this depends upon mitigation strategies in the area and once we get to an effective vaccine. Next slide, please. This is the last one before we get to the FAQs, and then you guys we can answer some of your questions. So I want to talk a little bit about a risk budget. So this is a concept that is always there, but this is what is your risk budget for COVID-19? And so I always, talk when I'm talking with my friends and family members and any families that I take care of, I say, well, what's your risk budget? So what this is all about is thinking about your life and your unique family, whether you're a multi-generational family, whether you're just a single parent and a child, or whether you've got a huge family. It's thinking about what you're doing in home, what your community transmission looks like, and what you typically do in a day, going to school, going to work, coming in contact with neighbors or family or friends, and identifying what's your risk budget. There are lots of activities that are very high risk, such as you can see on the slide here, going anywhere indoors is much higher risk than being outdoors. Going on an airplane, traveling in a confined space, going into a movie theater, as opposed to low risk activities, outdoor dining, going to a beach or a park where you're outdoors and you're very distanced, grocery shopping, as long as you're staying 6 feet away and you're wearing your mask, or going to a doctor's office where there's a ton of protection measures in there. So thinking about for your family, what's your risk budget? I tell people don't blow it all on one simple thing when you know that's your risk budget is not there. And so try to space it out and do more low risk activities instead of one really big high risk activity. But again, it's very unique to your family. So I think that the next slide is moving on to the risk scale. I forgot about this one. This is a good one. And this is, you could actually just Google this and look for COVID-19 risk scale. It's from the Texas Medical Association. There have been lots of these put out. These were expert opinion. And these are activities that are low risk and high risk. And so the general gist here is that low risk things are essentially getting takeout, being outside, playing tennis is on this list, as opposed to high risk things, which are indoors. So the general gist is, as long as you're 6 feet away and you're outside, it's much more low risk than something that's high risk and inside where there are lots of people and you can't be socially distant. I think I'm gonna move on to my tips from our primary care providers.
Good. Dr. Suleiman, thank you so much for that. That's really helpful information. And we already have some questions for you that are coming up in the chat. So we're gonna get to those as soon as we can. So what we're gonna do, we're gonna pivot and just talk about from a primary care perspective, some of the things that we have been answering a lot of parents' questions about. So I'm gonna turn to Dr. Lehman. I think you have a couple of slides you want to talk through.
Sure. Thank you, Bill. Hi and good evening. And my name is Harry Lehman, and I'm a Nemours pediatrician in Millsboro, located in Delaware's southernmost county, Sussex County. Yeah, that's the county with all the beaches, and you saw how dark our numbers were on Dr. Suleiman's caseload there for the state of Delaware. But we have a lot of fun things going on, but that brings a lot of people into our county too. So back to schools though, many of you have probably already made a decision about in-person versus remote learning because your school districts came out this week with some recommendations. But some of you will have to make that decision maybe within the next few days. And we thought that you should hear from our pediatric experts at Nemours. And so what I'm going to do is just present some of the highlights of what the experts have put together for us so that you can begin to figure out your risk budget with a few little quick facts. So let's start on with the first one, and that's the fact that, I think most of us would agree that schools benefit children, right? But each child benefits from school in a slightly different way. So for some kids, it's purely learning. That's all they're there for. But others, it's an important social outlet. For some children with special needs, that's their source of services. And for many children, to be honest with you, it's a focus for their athletic and artistic activities as well. So having said that, then who's at risk? Well, in reality, it seems like teachers and staff probably face the highest risk of severe COVID disease. So, unlike children, who most often will have asymptomatic or mild infections with COVID, adults, well, they tend to get more moderate and severe symptoms. So, prevention of COVID infection for teachers and staff really should be one of the primary aims for each of the school districts. Teachers must remain aware, well, that it's their fellow workers and colleagues at school that probably pose the greater risk more than their students do. And even contacts with family members outside of the school may present a bigger risk. So, what do you do to mitigate that risk? Well, we feel that universal masking works. Okay, we strongly recommend that masks are worn by all students, teachers, and staff, and that hopefully mask use, well, really should be made part of a requirement to participate in the school. I mean, there's just so much extensive scientific literature that supports the use of, well, either a cloth mask or a low-level medical mask, kind of those paper masks that you might see the doctor in the office wearing, that they're an effective means of reducing the transmission. As Dr. Suleiman said, we're really doing this for other people, not necessarily ourselves, to keep that transmission rate down to a minimum. We also hope that schools will strive to reduce crowding and maintain maximal classroom ventilation. So that may mean that your child would end up spending, hopefully, maybe a little bit more time outdoors when possible. So that's always a good positive thing, getting our kids outside a little bit. Hopefully the number of visitors to the school would be minimized by the school. So that may mean that, if you have to drop your children off at the front door, you don't really get to go in and walk them to their classroom on that first day of school. But the number of adult visitors to the school, we would like to see that minimized. School attendance policies should be reviewed and enforced. So when I'm talking about that, it's about symptoms of illness for children and for the adults, the teachers, that we should be watching for and then excluding or excusing those adults from work to minimize transmission while they're in school. And you can do your part as a parent too. I mean, there were times where we would pack up our children and maybe send them off if they had a cold, thinking, well, I got to go to work. Let's just drop them off at school. But hopefully, as you heard Dr. Suleiman talk about the different symptoms, that you'll think a second time before you send your child off to school. Because remember that list? Oh my gosh, it was fevers and cough and shortness of breath and fatigue and muscle aches and headaches and loss of taste and smell and sore throat and congestion and nausea and vomiting and diarrhea. And it sounds like almost any virus. It also reminds me of the flu. So we're going to remind you, get your flu shots too, because we want to be able to help you decide, is this the flu or do we have to do further testing for COVID? So social distancing and masking, let's be honest, they're not always practical, okay? So social distancing, for example, on a school bus is almost impossible. Masks must be taken down to eat. Band members, so kids that like to play in the band, well, they can't play their instruments with their masks on. And team sports, well, there's a lot of close contact that's entailed with many team sports. So families really need to consider the risks and benefits of these activities. Kind of going back to your risk budgeting, when you ask your child what are their preferences, you're going to have to look at what's important to them, and that has to play a role. They may not always be happy, but you should at least know what your child's wishes are so you can address them in case there's some disappointment. A child's risk of COVID infection is probably going to be more directly related to their family members and the behavior of us as parents in the home than it is the school. So keep that in mind, model good behaviors while you're at home. Homeschooling, that may actually help the schools because it's going to reduce the risk of COVID infection and transmission to teachers and in children who are attending the school in person by just simply reducing the number of children in the classroom. And for some school districts, that may mean reassigning some teachers to be able to do homeschool remote learning classes and be out of the school building to begin with. Remember, we want to try to minimize the number of adults in that school building too. And I want you to remember something, that infection at a school is not a failure on the part of the parents, the school, or the school district, okay? I think despite our best efforts to just wipe out disease transmission, it's going to occur. And kind of complete prevention at a school, it's really unrealistic. And I think a more reasonable goal is really just to try to minimize the COVID transmission within the school. One side note to put in for vaccines, all children should be vaccinated according to the CDC's recommendations. And I'd like to bring up a note about measles. Measles in children actually carries a higher mortality rate than COVID does for your child. So don't underestimate the importance of all of those vaccines, and remember to get a flu vaccine too. Contact your pediatrician at Nemours or your private pediatrician and find out when their flu vaccines are going to be available, because I think it's going to be very, very important this year for flu vaccination. Two last points of compassion, I would say. Remember that not all families have a choice. Some families have to send their children to school because of the parents' work situation or special needs for their child. And many of these parents are going to face some fears and maybe some guilt about the situation and maybe the decision they made. So as a community, as fellow parents, as their pediatrician, I think we need to be reminded, like, be reassuring to those parents, provide emotional support, because this is not an easy question to answer for all families. And the final thing I'd like to leave you with is expect change. New scientific information comes to light almost on a daily basis, it seems. And so public health has to respond to that, and it has to evolve. And so what we said 3 months ago, now we're better equipped with more science to say, you know what, this is a better direction that we should be going. So just expect change and remain calm, and don't rush to judgment with your other parents that you have to interact with. Thanks, Bill.
Harry, thank you for that. That's really helpful. And I think it's really sage advice. And I love this idea of being compassionate to ourselves and to your fellow parents. Not everything is what it seems to be. So that was great. We're going to switch gears. Dr. Coutinho is going to talk about some common myths that we're going to spend a few minutes on, and then we're going to get to our questions.
Thanks, Dr. McNutt. I'm Dr. Yamara Coutinho, and I work in the Concordville office at Nemours. I'm seeing on the chat some names I recognize, so I know our patients are out there. Hi, guys. So I wanted to focus on a few of these commonly circulating things that we're seeing on Facebook. So just like all of you, I also see these things on Facebook, and sometimes it's hard for me, even at first, to tell, is this real science? Is this real? Or is this just something going viral? So I think it is really important, just as Dr. Lehman said, things are changing very rapidly. And typically when a big scientific study comes out, it's very well vetted by other doctors and scientists before it gets out to the public. What we're seeing with social media in general, and now with COVID more than ever, is that there's a lot of what we call preprint studies coming out. So pretty much anybody can put something in a preprint article, and it doesn't have to be vetted or proven. So when we see these things, we do have to take a little bit of grain of salt before we decide how to act with them.
So the first one that I started with was a big one in the beginning. So this was back in March when the French authorities basically warned against using ibuprofen in the setting of COVID-19. And this was taken pretty widely, so much so that the World Health Organization actually was recommending against the use of ibuprofen in the setting of COVID for a while. And even I went out and bought a lot of Tylenol for my family as a just in case. And patients are still asking us about this. So the data initially was kind of based on a few anecdotal studies of patients with other underlying problems, some of them having kidney problems, which is where most of this kind of came from. So this one is false. And now the World Health Organization has actually retracted that, and they're saying they're not recommending against the use of ibuprofen, even for people with COVID-19. So if you like ibuprofen as your preferred choice for fever reducer or pain management for your child, you can go ahead and use that safely. So the next one is really interesting. This one was also all over Facebook, and some families were asking me, should my child get an extra MMR vaccine to prevent death from COVID? So there are kind of two reasons that this was kind of brought up and why scientists thought that the MMR vaccine might actually lower your risk of death from COVID. One is more observational data looking at different countries that have very high versus very low MMR vaccine rates. So for instance, Belgium has a very low MMR vaccine rate. They didn't start using the MMR vaccine until 1985, which is almost 20 years after it was available elsewhere. And they have one of the highest death rates from COVID. On the other side of the spectrum, Hong Kong, which was right in the eye of the COVID storm initially, they have one of the lowest death rates from COVID. And very interestingly, in 2019, they went on a national campaign to get everybody up to date on their MMR vaccine and even gave healthcare workers an additional MMR vaccine. So some of this is it correlation or is it causation? There's also some research that suggests that maybe a live attenuated vaccine, which is what the MMR vaccine is, it's a live but weakened virus, can actually prevent the big overwhelming inflammatory response that is often the cause of death with lung injury with COVID. I did find an older article, which is kind of interesting, from 2007, that looked at immunity in mice when mice were given all the childhood vaccines one at a time. They looked to see, does that actually prevent, does that protect you from SARS, which is a very similar vaccine, and that did not pan out. So I think at this point, there's not enough evidence really to say that this is true, and we're not recommending getting that extra MMR vaccine at this time. However, we do know that the MMR vaccine is very effective at preventing measles, mumps, and rubella. So you should get that MMR vaccine. And one of the studies talking about the prevention of the inflammatory response, they even say in their article that this is a really low risk, high reward thing to do. So if your child is not up to date on their MMR vaccine, please get one. I do worry specifically about measles, and Dr. Lehman was talking about the importance of being up to date on childhood vaccines in general. But specifically with measles, we need a very high vaccination rate in the community to prevent a measles outbreak in the community. We're talking upwards of 90%. So it doesn't take much to dip during the pandemic if people are not getting up to date on their vaccines for measles to enter the area. So please get all your vaccines, flu shot, and the MMR vaccine. And the final one, this is kind of the newest one to hit Facebook. This is talking about, I saw many articles or news stories saying wearing a gator mask might actually be worse than wearing no mask at all. And remember, Dr. Suleiman was talking about the reason we wear a mask. It's really to prevent others and to prevent our droplets from getting out to infect other people. So there was another preprint study, a very small study at Duke, done by Duke University, where basically they took, so you can advance to the next picture, they took a bunch of different kinds of masks and had one person wear each mask and talk and say, stay healthy, people, 5 times. That was the study. And as he spoke into essentially a laser beam, which made all the little droplet particles visible, and a computer videoed it and was able to count the number of particles. So in their little study, the best protection, the fewest droplets got out from the N95 mask. So that's what we wear as doctors when we're taking care of somebody with COVID or with suspected COVID. That one also protects the user very well. The worst mask, as we know from the Facebook studies, Facebook articles, was a gator mask. And so what they kind of proposed happened there was that the stretchy spandex containing material actually chopped up the droplets into tiny droplets. And that almost suggests that this gator mask makes you more infectious because of, remember, those droplets can go farther. So this was one person wearing different kinds of masks. It was a very small study, not vetted by other scientists, and not repeated. And that's one of the most important things when you're vetting a study. So there was another kind of rebuttal to this, even since we made this slide, where somebody actually took a nebulizer machine to create lots of little particles and had to go through a mask. And that study showed that every single type of mask, including a neck gaiter mask, is better than not wearing a mask at all. And that makes more intuitive sense, that having a piece of material there stops particles from going through. So the take-home message is just wear a mask. It's a way to protect other people. And if we all wear a mask, I protect you, you protect me. And whatever kind of mask your child is most likely to wear and keep on is probably the best mask for your child.
Yikes. Okay. So thanks, Dr. Cortino. So let's move on to some of the questions. So we are fielding questions every day by multiple families. As I said, every family is different. And I'm going to incorporate actually some of the chat questions into some of these questions, guys. So it's going to throw you a little bit of a curveball, okay? So the first one I've asked Dr. Lehman to address. Is it safe to send my child to school or daycare? And what precautions should I take? And the additional question I want you to answer, Dr. Lehman, or at least get started, is if my child has special needs, if my child has any medical issues that may put them in a higher risk category, maybe Dr. Suleiman can help us with that question, okay? Dr. Lehman, can you unmute yourself?
Oh, yes. Okay. All righty. Well, I think it would be a yes to that answer if it's safe, and so that's our biggest question. So we know there's a lot of benefits to learning in school, the social interactions, the food, the sports, and to go to the end of the question, and providing special needs. So in many ways, parents are going to have to go back to their risk budget a little bit for their children with special needs and really look at the benefits and some of the risks. But I do think you have to make sure that masking is going on. I mean, our American Academy of Pediatrics actually recommends all children above 2 be wearing a mask, same as adults, and in addition, do the social distancing. So then that brings up another question, and I'll answer it myself, is, well, what happens in daycares in the early grades when you really can't get children to always wear a mask? So you look at other things to minimize the risk. Like you look at the number of adults in the building. Remember, fewer adults in the building reduce your risk. And you have to remember as a parent that some of the risk for your child is probably a little bit greater at home than it is actually in a daycare or the elementary schools. And back to masking, just to finish up on the question, I can't reinforce it enough that you have to model good behaviors as a parent at home. Teach your children to wash their hands, model wearing the mask yourself when you're out in public, role play with dolls, put masks on princesses and superheroes, and try to make masking part of the norm in your home and part of your child's world. The children really can begin to worry when they think that they might be different and they don't fit in. And so it's our responsibility as adults to make that mask something that's a positive in their world. So I would say feel good about making the decision to go to school and daycare, but do it with safely. Just do it safely.
Dr. Suleiman, can you help us answer the question about kids with special needs, kids with asthma, kids with other health issues, and the safety of going into a school setting?
Absolutely. So we go back to our risk budget, but we also go back to what the school is doing or the daycare is doing to provide as much of a safe environment as possible. And sort of the things that I went through, including rigorous cleaning and everybody wearing masks and social distancing as much as they can. I do think it's safe. It is not without risk. So it goes back to your risk budget. Some families do not have the ability for a care provider to be at home, and them being in daycare or school is their way to get the care that they need. And I absolutely think that that's important. And so I do think it's safe. But I would encourage families to, and I've done this for my Avoid School, ask what they're doing, and they will likely have a reopening protocol, and ask them for that if they haven't shared that with you, and ask them sort of for what their policies are going to be regarding all of these really important things. And if you don't feel safe doing that, then I think in that situation, I would be very careful. But most places, it's required and recommended, and they're doing all of those things. I do think it's safe as long as the safety precautions are in place.
Mm-hmm. One of the things I like to highlight what Dr. Lehman was saying about modeling good behavior. In our office, all of our patients have to wear a mask over the age of 2. And there seems to be a direct correlation with how well the parents wear their mask and how well the children wear their mask. I've been really impressed with some of our younger kids, 2, 3, and 4-year-olds who don't touch their masks. They're perfectly comfortable with their mask. And my observation is that the parents are also, that the parents aren't constantly shifting their mask, taking it down below their nose or over their chin, or down below their chin. So I think that modeling behavior is very important to help your child with masking and keeping that mask on. The next question, again, I've asked Dr. Suleiman to answer. What are the current recommendations for quarantine after exposure to COVID-19? Is it 14 days or is it 10 days? There has been some controversy, or I think some confusion over how many days we need to stay quarantined.
Sure. So the current recommendations for quarantine after exposure is 14 days, because the incubation period of the virus is 2 to 14 days with an average of around 6 days. But the recommendation for quarantine after testing positive is 10 days. So, and the reason for that is that once you test positive, you can come out of quarantine 10 days from your test and fever-free for more than 24 hours without fever-reducing medications and improvement of symptoms, whatever those symptoms were that brought you to the diagnosis of COVID-19 infection. So it is 10 days after exposure. That is for most patients. Immunocompromised patients is 21. It's actually 20, exactly 20. But if you have been exposed at school, for example, it is 14 days because the incubation period is as long as 14 days.
Good, thanks. The next question, I'm probably fielding questions daily about sports and safety. So I've asked Dr. Coutinho to take a crack at those questions, at that question.
So thanks, Dr. McNutt. That is a question that I get every day too, and it's a tough one because there's not a one-size-fits-all answer for that. Especially as pediatricians, we are always trying to encourage patients to be active and participate in things like sports because it's important for their well-being. So it is tough to say, even sometimes, that kids shouldn't participate in sports. I think the way I've gone about answering this question is really just boiling it down to lots of things that Dr. Suleiman has already said. So what are the safest ways to go about things during COVID-19? Outside is always safer than inside. If you can find a way to participate in these sports activities while still maintaining 6 feet of distance, that's better. If you can not share an object that you're touching, so for instance, basketball is indoors, you're in very close contact with people, often physical contact, and you're all sharing the ball. So that to me seems like a more high risk sport than participating in something where you can maintain more distance, maybe lacrosse, although you still have a lot of contact, but you're not sharing the ball. Maybe some of these sports teams can modify some of the game rules and gameplay to allow for more distancing. Cross-country running, that would be great if you can just maintain that distance. That's a much safer option. It's tough because I don't want kids to miss out, but I also do think that some of these sports are pretty high-risk activities.
Dr. Suleiman, can you help us with that second half about if playing sports and wearing masks as we play? I've had questions, both pretty competitive basketball player who's in a bubble and really says he just cannot wear a mask, and then parents saying, how can I possibly have my child play basketball without wearing a mask? Can you just spend a second and just tell us what your thoughts are?
Sure. So this is as we've all said, these are very hard questions. So from coming to you all as a doctor and as a mom, my doctor hat tells me no one should ever take off their mask unless a doctor asks them to or they're at home. So I would say it is not safe to play without a mask. I recognize that it is hard to, it is very hard to run with a mask on from experience, and it is very hard to play with a mask on, but your risk increases significantly. So if you are willing to take that risk, that is okay. The NBA is only working because they're testing people every single day, but you are at the highest risk to spread secretions out. So there are low-risk sports and high-risk sports, and basketball, unfortunately, is certainly one of them. There are lots of other, you could talk about sports, but I would say it is not safe to play without a mask. I recognize as a mom, it's killer to have to tell your child this and to do that, but I would tell you that, COVID-19 is going to be around for a long time, but it's not going to be around with the severity that it is right now like this forever, because we will get a vaccine, we will have herd immunity, and things will be better. So even though it stinks this year, it will likely not stink next year. And that's how I have shared this with my child regarding other things, but that may be a way to phrase it to your kiddo.
Yeah.
Mm-hmm. And the other thing that I've noticed is that the younger kids actually adapt to this much better than our older kids. And so maybe in the elementary school age where, it's not an oxymoron, it maybe is kind of a go against the fact that they don't spread the virus as easily as maybe older kids do, but they also can tolerate the mask wearing while playing sports probably better than some of our older kids, quite honestly. All right, you guys, we're coming up on 7 o'clock. I want to be respectful of your time. The group has decided that we were suspicious that we might go over. So we are happy to continue. We have a couple more questions from our questions frequently asked, but we also want to get to your questions too. So we're almost there. We're going to be staying for another 15 or 20 minutes. If you can join us. If you can't continue with us, this is recorded, that you can listen to the last 15 or 20 minutes at your convenience. Okay. For those of you who can't stay with us, thank you so much for joining us. These are some of my favorite people, so it's just really nice to hear them give their opinions, and these are colleagues who I really hold in high esteem. So thanks to you guys too. But we're going to continue if you guys are up for it, okay?
Yeah.
So with that, let's talk about remote learning. I think, this is something that we don't spend a lot of time with because we're so caught up in deciding should our kids be in-person school or should they do the remote learning. Because so many of our kids they don't have that choice, that their schools are recommending remote learning at least at the beginning of the school year and to be reevaluated as the school year goes on. Both Dr. Lehman, why don't you start? Why don't you give us some ideas about what you're telling your parents about how to maximize or optimize their remote learning?
Yeah, thanks, Bill. The first thing I would recommend is for parents to go back to their pediatrician, like my parents are coming back to me, and ask about your child's developmental stage, because just as you mentioned earlier, that what works for an elementary school a child may not work for a teenager. And so it's important to kind of figure out what is developmentally appropriate for distance learning. And sometimes you just need the pediatrician's help to say, okay, where are we? So, plus, some children actually are diagnosed with attention deficits and other issues of focus that may change, but I still think your pediatrician is going to have some suggestions for you. And I can't stress the importance for all ages of children that they maintain kind of a predictable rhythm in each day that they have. Children thrive on rhythms. And so make sure you're getting them up at the same time of the day to start their day. Provide them with meals at the same time. Give them outdoor time so that they can refresh a little bit in between those study sessions. Try to minimize distractions as best you can, although that's not easy at home. And get them to bed on time. Okay. Remember, remote learning is not a vacation. Okay. This is not an extension of your summertime. This is school. And that's going to take a mindset change for parents. I was just talking to one of my parents right before I came in here, and she said, yeah, we've been going to bed late. Getting up late. I'm going to have to change my routines. But I would encourage you as parents, get back to a school routine. Strive for that 9 hours of sleep at night. That's my thoughts on the subject.
Mm-hmm. Dr. Cucino, do you have anything to add?
Yeah, I have a few thoughts, and I'm also seeing some questions on the chat about specifically about screen time and how are we going to keep how are we going to keep kids on the screen the entire school day? So initially when I thought about this question, because I think about it for my own children, I've got a wide variety of ages at home from kindergarten all the way up to 7th grade that are going to be doing remote learning. And one of the strategies that I'm trying to come up with is how can I take that remote learning that they're doing and bring it to life for them? And so what schools would typically do would be doing some activities, maybe doing some field trips to kind of tie it all together and make it interesting and keep them focused. And so as a parent, I'm going to try to do that as much as I can, even on the weekends when, if they're learning about nature, how can I tie that in on our walks? And it's hard because most of us are parents and not trained to be teachers, but I think we have to try to keep our kids excited about what they're learning and do as much as we can to bring it to life as the schools would normally do. The screen time piece is a big concern for all of us, for our patients and for our own kids. And really, if I think it's going to depend on how the schools do this. If schools are going to be synchronous for most of the day, that's going to be staying on the screen in real time most of the day. I think at least for lunches, and I think I've seen some breaks, at least in my kids' school day information that's come out. If things can be done asynchronously, maybe your child will learn best if you kind of do what Dr. Linden did or talked about and try to assign times and routines, but also take time to take breaks with the kids. They really need to be off the screen. And then as much as they're all going to hate it, because my kids are all about Minecraft and Animal Crossing and all of that, we have to try to reduce the screen time where we can, because they're going to be on screens for school and we can't get away from it, but we can try to minimize the non-essential screen time.
I think I would add, and this goes to one of our great questions was, the AAP recommends only 2 hours of screen time, and here we're now having, so I would discount the school screen time. I would explain to my kids that this is school, this is not school. And so try to stick to that 2 hours of less of the non-school screen time if you can. And be very clear and direct about what is and what is not screen time. The other thing that I would add to this with remote learning is actually staying in contact with your child's teachers. What we're finding is, especially some of our older kids, they're not completing their assignments, or they're forgetting to hand them in. And so they're getting poor grades because they're not as engaged. So if you know what your child's assignments are, and you kind of play cleanup and make sure that they're getting their assignments in to make that learning experience the best that it can be. And they do put a lot of emphasis on grades, and kids feel good when they get good grades. And as we all know, grades are really a reflection of how much of that homework or that extra time that we spend. And so make sure that your kids are completing all of the work that is being required of them, and not expecting them to do it on their own. That may be different than what you were used to when they're in-person school. You may not have to worry about that as much. Now that they're at home, I think it is your responsibility as a parent to make sure that they are completing their work. But I like that the question about the screen time. We're giving our kids mixed messages. So I think if we're clear about that school versus non-school time, I think it's going to be very important. And then the last question we have here, Dr. Suleiman, if you can help us with, this goes back to the risk budget that we were talking about. You know, if we have people, older relatives, family members that the kids are living with, you know, relatives who may be higher risk because of underlying conditions, should those kids be going to school or not?
This, I think, is probably the single-handedly one of the hardest questions to answer, because I think about my parents. I don't live with my parents, but we haven't seen my parents or my in-laws in 6 months. But if they lived with us, this would be much more challenging, and I think our risk budget would be much lower. We live in a household with 2 healthy 40-something-year-olds and a 6 and a 9-year-old. And so, but I think that it's all about your risk budget. If you have an older family member or someone with a very immune compromising condition that falls in that high risk category, I think your risk budget should be very, very low. I think that it is unique to each family, and it is also unique to the area you live in. I mean, even in the city of Philadelphia, you have got areas that have much higher rates of disease than others. And so if you live in a community where you have a very high circulating rate, or if you live in a community and that's where you go to school and there's a high circulating rate of coronavirus, I would be careful about sending your kiddos to school. But again, it also goes back to your risk budget. So mine is going to be very different from maybe Dr. McNett's, or very different from another family even across the street who lives with a grandparent in the household. But it is true that patients 65 years of age and older are at a higher risk for getting COVID-19 infection. I will tell you that I think the most important people, even though we want to protect children, of course, but the people who are getting most severe disease tend to be the adults, and the adults with lots of high-risk medical conditions. So just keeping that in mind, I think my risk budget would be lower, and I would really consider the environment of the community and the school that I'm in.
Mm-hmm. And Dr. Suleiman, when you say that, you know, I'm mindful of our educators and how our educators are having to deal with this kind of exposure, that their risk may not be the kids, it may be their colleagues. And just being at school with colleagues may also put them at risk. So this is what makes this whole issue so difficult, because it's multifactorial, and we have to think of, you know, what the child's needs are, what the parents' needs are, and also what our educator needs are. All right, you guys, I'm going to go to the chat if it's okay with you guys. And one of the questions, this is for Dr. Suleiman. We're talking about exposure and we're talking about testing. The question, I think I'm getting this question right, is if you're around somebody, you know, less than 6 feet and you're around them for 15 minutes who's been infected, does that include if they were masked or unmasked at that time?
Yeah, very, very good question. So the CDC has set forth, so we initially started encountering this at the beginning when we were thinking about our healthcare providers, because, you know, in March, we had no idea if this was going to be pediatric focused or adult focused. And so what I would say to you is that if you come in contact with me and I'm infected, I have my mask on, you have your mask on, we are less than 6 feet away for a period of time, and it's more than 15 minutes, it's still considered a low-risk exposure because masks are on both persons in that encounter. If the masks are off and it's 15 minutes and less than 6 feet, that is considered a high-risk exposure, and it is much more significant. So if you, it's really all about wearing the mask. It's even less about eye protection. It's mostly about the mask, because that's going to mean that your mucous membranes in your mouth and your nose are very exposed to the other person who is in turn not wearing a mask. So hopefully that helps answer that question. It is a much higher risk exposure without masks on.
Okay, thanks. The next question has to do with in-school and in-school activity, is asking about lunchtime. And, you know, how our kids, obviously we have to eat without our masks on. So what would be the recommendations for lunchtime at school and kids eating? Actually, how about if I take a crack at this? Is that okay? I want to talk. I think this is actually a really interesting question because I was thinking the same thing. And one of the things that we're asking people to think about is take your child's day, if you're going to go to school, and kind of walk through their day mentally as to what their exposure might be. How many kids are in their classroom? How does the day start? Are parents dropping off kids? Are the parents taking their kids into the class? And what are we doing about recess? What are we doing about lunchtime? How do we leave school? So those are the things you might want to think about as you're making this decision, and just, you know, take a walk through your child's day and consider each area as a separate risk and what we're willing to accept and what we may not be able to accept. So when it comes to lunchtime, well, the recommendation is that we don't gather in a large lunchroom, that we take lunch in the classroom that we're at. If we can do outside lunch, that would be best. If we can't, that we maintain that 6 feet distance and try to keep lunch to a minimum and get masked as soon as lunch is over and go on with our day. It's going to be, it really is kind of, I think, one of the things we're trying to balance is what we're experiencing, that some of our kids are actually afraid of all of this, and that they have a lot of anxiety around exposure. So they're afraid to take their masks off. And then if we're asking them to take their masks off at school with their friends and eat, that can elicit some anxiety in those kids. So we have to be careful to explain, you know, during lunchtime, keep your distance, eat your lunch, go back. A lot of the schools are actually dispensing with lunch, that they're limiting the hours at school, so lunch is not included. And I think that's also a really smart idea. Some schools are doing morning sessions and afternoon sessions with different cohorts. And I think that probably is the best way to get around this really difficult issue about lunchtime. Okay. Harry or Yamira, anything to add to that?
No, I think you summed it up. It's really tough. Every school's a little different too, because their ventilation system and the age of the building has to be considered, and that's going to make it difficult to just make a blanket statement, which you purposely didn't do. But you know, and also short lunches, maybe less than 15 minutes. You know, I don't know. Can you wolf it down the way? You know, we did
speed eating. That's great for digestion.
Yeah. Yeah, I think that some of the school districts would say 15 minutes, and then if they're in a classroom all facing the same direction, not at tables facing each other, and then doing it outside. These are just other things that I know I've been trying to come up with to try to prevent infection. But if it's short, it's really going to be, I think, much better than all being in the same space, crowded together. If they're spread apart, I think it's going to be much better.
Yeah, thank you. The next question actually isn't about school, but I love this question, so we're gonna ask this question anyway. It's actually about dental care and routine dental care. Should we try to get back to the dentist? Who says yes? Raise your hand. Okay, I feel so, and I think, again, you have to make sure that your dentist is also following good protocol. You know, we have made a very huge effort we decreased our patient panel size, so we don't have as many patients in the office at any time. We're taking our patients directly back to the exam rooms and not spending any time in in our waiting rooms. We have, you know, one direction. We come in one way, we go out the other way. So we have really taken great strides to make our offices safe. And as far as we know, I can tell you we have 20 offices in Pennsylvania and Delaware, and none of ourselves or our colleagues who we work with have been infected. And I think it's because we're taking such good care of maintaining good hygiene, wearing masks, and, you know, and I'm hoping that our dental colleagues would do something similar. And honestly, you know, to just from an economic point of view, they need business. And unless they do these things, they're not going to get the business. So when you're making your appointments, ask your dentist, what accommodations have they made for COVID safety? And I think that's a very fair and an important question to ask. Let's see, we talked about aiding in the classroom. Okay, here's a question about bathroom use and during the school day. What about bathrooms? How can they possibly clean in between them? Are there bathroom attendants? Like, how do we manage bathroom use at school? Oh, Dr. Suleiman, you want to take a crack at that?
Yeah, I mean,
I don't know.
6 and 9-year-old. I know. I have 6 and 9-year-old boys that they don't ever want to wash their hands ever. God help us. So I would say this: most schools, I mean, you can't wash after every child. If you can and have a bathroom attendant, that's amazing. But public schools are not going to have that, and most schools are not going to have that. So what I have recommended to some various school districts and people that ask this question is at least say, like, instead of cleaning, you know, once a day at the end of the day, they get cleaned every hour, every 2 hours. So you and kids wash their hands. If they wash their hands, they should be okay. And if people are wearing their mask, there's less of the ability for their secretions to go out into the environment. And so if they wash their hands like they're supposed to do all the time, and they're cleaning every 1 to 2 hours and sort of setting a time frame, that should be a better scenario. It's those high-touch surfaces that need frequent cleaning, literally like every 2 hours.
I think what I would add to that is one person in the bathroom at a time. As we know, kids can get into mischief. It's usually an unsupervised area. And so I would, you know, look for, you know, only one person in the bathroom. And then the other thing too is, even though the kids may have washed their hands in the bathroom, maybe insist that they wash their hands when they come back into the classroom, just to double check. Depending on the age of the kids, again, our younger kids probably wouldn't, you know, they may not have washed their hands. So I think it's just to be doubly sure. We only have time for 1 to 2 more questions. Actually, this is a question that came, I have 2 more questions, and these are both really good. One is, the question is about, you know, we're doing this massive cleaning, and there's a lot of chemicals involved with our cleansers, and, you know, is that a concern or exposure to our pediatric population? Any thoughts on that? I hadn't thought of that, about, you know, the environmental exposure of our cleaning products.
Well, I'm not actually, I have a degree in chemistry, so I should know this, but I would say that, you know, these chemicals, when we're using them to clean, there's a couple of basic things that you have to do. One is the surface has to be dry. You have to give it time to dry. So in between uses, there has to be time set aside to let the room fumigate, if you may, let the chemicals evaporate off the surfaces and dry out. And I would also say that surfaces that are left kind of sticky probably aren't good because they're also going to end up trapping dirt and germs. So you have to know how to apply the chemicals, whether you have a wipe like we have here in the office, and we try to rotate our exam room so that you know, we give about a half an hour in between each use of each individual exam room so that they're wiped down immediately, they're given time to dry out, and the air is exchanged too, because these chemicals are going to be up in the air. So not just the virus goes in the air, but so do some of the chemicals. It's a really, really good question. And I think it goes back to, I think, ventilation and time to let the surfaces dry and make sure everybody's reading the directions on how to use them.
And then the other concern that I have, you know, just as with any chemical compound, is safety and ingestion. That, you know, that they're not left unattended, that they kept, you know, that they're kept locked and out of reach, especially of our younger kids. if you're in daycare or even at the younger elementary school. And then the last question that I think is really a top of mind for a lot of people, and I think there's this is such a great question also. It's about the consequences of not going to school, the consequences of not being able to socialize with peers. Was there any long-term effects that can happen because of lack of socialization? And then there's a follow-up
I'll try to
question
tackle that
to
one.
that. Yeah, good.
So this is, I mean, I think that this is the first time in at least my lifetime that this has happened, that we've had an entire world of kids not attending school. At least most of our country is not going to be attending school, at least for now. And I worry about this as a parent, and I worry about it for my patients. So I think that the onus is a little bit on us as parents to try to create that social activity for our kids in a safe way. So if right now it's not safe for them to be indoors at school with hundreds of other kids, can we connect with other parents and try to provide safe outdoor activity alternatives so our kids can still maintain that social interaction? Because although we haven't yet quantified what kind of impact this is going to have, it's going to have impact. And I think some of us are already seeing it in our homes with our kids. So we've seen a lot of depression. We've seen kids just being unmotivated. And this is something that really worries me. So we do have to weigh out that risk of the virus and the risk of the social and emotional impacts of our kids. So I think if you can reach out to other parents, I know for my school district, there's a Facebook group dedicated to this, people looking to try to create little pods for outdoor activities. I think that probably exists for other school districts as well. If you can try to create that outside of school for your kid, I think that will hopefully mitigate some of that impact.
Yeah, I'd like to add to that just briefly that it reminds me of the American Academy of Pediatrics recommendations for getting children together in just small groups. I mean, their first recommendation would be kind of one-on-one and do it outside. But even smaller groups, if you can get them together, you can stay outside. I think it is up to us as parents, just as you said, to work at bringing some of those social connections back so that our children are safe, but they do have a little bit of a connection. Not large groups, but just one or two.
Mm-hmm. I think that's excellent. The other thing that I would add is I was thinking about this question from a different angle. I think of kids as being incredibly resilient. Mm-hmm. So we think about long-term effects from this sort of isolation. The bottom line is we just don't know. Mm-hmm. I mean, there are anecdotes of children who have been neglected, but our children are not being neglected in this situation. They're just not being as socially stimulated as they usually are. So I am not as worried about the long-term effects, but I am worried about that sense of isolation, that sense of anxiety, and the sense of depression that some kids are going through because of this. And it's very difficult, I think, as a parent to keep our kids engaged, make sure that they're not, quote, bored. And I think the way to do that is, again, by, planning events, getting outside, having maybe something out of your normal routine to look forward to. Get your kids cooking, get your kids outside running and playing, get out and run and play with them. We're hearing about the COVID-19. A lot of my families have gained weight, not just the kids, but the parents are also because of the lack of activity. So this does take effort to do this. We know this. Okay. With that, again, I'd like to thank our panelists for joining us. And if we didn't get to all the questions, you guys really came up with some great questions. We didn't get to, even a tenth of them. But we're going to ask you to go to our Facebook page, resubmit the questions, and we will get back to you and with, hopefully answer your question as best we can. And if you want, we can probably do this again if you have more questions. We can dispense with the ID tutorial, as good as that was, or we can just do question and answers for an hour. And I think all of us would love to do that. So let us know if this was helpful. If you want to do more of this, we would be we would really like to do that. So let's talk briefly about our takeaways. Think about your family's risk budget. I think that's a really great way of making some of these decisions based on what's going on with your family, who's in your family, what are the special circumstances within your family. You want to stay updated as to what's going on in your community. Know what the number of cases are in your area, and that also will help inform some of your decisions. You know, we have done a really good job in this part of the country after suffering, you know, in April and May of getting our viral load down within our communities. And this allows us to even think about going back to school. We're fortunate in that way. There's some parts of the country that just can't because the virus is too high in their area. When sending your kid to school, you want to look for the requirement for masking, physical distancing, all the precautions that we've talked about. We want you to speak up and be your child's advocate. Make sure that your schools or your daycares are following good protocols, that you feel comfortable. Walk a day in your child's life at school so you get all the information. And then when in doubt, give us a call. This is what we're here for. We love answering these kinds of questions. This is what we've been, you know, this is what makes our jobs very satisfying, is when our parents are depending on us to help them through this really difficult time. We agree that this is tough, but please let us help you. And this is a plug for our kidshealth.org. This is a web-based, has great information on all things pediatrics, but especially for COVID. So visit us at kidshealth.org, and there's information about masking, helping kids cope with the anxiety, more information about MIS-C, COVID-19. Please check this out. And then let us know if this is helpful. And we would love to do this again. I can't speak for my colleagues, but I'm going to go out on a limb and say that this was a lot of fun for us. I believe that I guess this was fun, but it's very satisfying. This is what we trained for. And, you know, part of our job is educating our families, helping our patients. So thank you so much for joining us and for trusting us. Good. All right. Bye, everyone. Take care, friends. Thanks for joining.